Chapter 19, Foot, Ankle, and Lower Leg Injuries. I'll get my notes out, get my timer set so we can go ahead. Hold on, let me get my timer set. But hopefully you're able to follow these videos as far as notes are concerned. If you have any questions, comments, or concerns about the videos, or maybe you missed something in there, all you have to do is just message me and we'll address it immediately. Let's go. All right, so said chapter 19, the important stuff, those wheels, okay? How many bones do you have in your foot? 28, okay? And it is broken down into different sections of the foot, all right? Page 208 has a full picture of the entire foot as far as the bones that you are just, again, you want to be well acquainted with. You don't want to, as far as anatomy kinesiology, yes, you do want to know them and acknowledge them. Try to just find a skeleton either on the internet or maybe you can kind of use yourself as far as, identifying the bony areas of your body to really identify what the parts of the foot are all about. Okay, you have three parts of the foot. You have your forefoot, your midfoot, and your hindfoot, or what is also called your rear foot. Now, the part where the ankle is located is your hind or rear foot, okay? Because it's made up of your tibia and your fibula, okay? Another two important bones that are in the leg. All right, so then you want to go into knowing what bones are considered the midfoot. And those are your tarsals, okay? Those are all of your tarsal bones. And again, we won't go too deep into your tarsal bones, but just know that your foot is divided up into parts, okay? And it's all divided up according to that red line. All right, so we have your ankle, which also includes your talus and your calcaneus, okay, and also your tibia and your fibula of your lower leg, which is something that you could really feel for right at the front using your thumb or your fingers. Your medial malleolus is considered your tibia side, and your lateral malleolus is your fibula side. So, referencing atomic position or anatomical position. You want to think about what is the lateral side, and that way you can identify your fibula, and you want to identify your medial side, which is how you will know if it is your tibia. Okay. You do have ligaments on both sides, obviously, for support. So you could stand up on your own 2 feet. And one thing we don't realize is that it's so important for us to maintain flexibility in our foot because you can injure those ligaments in your foot. All right, so we talked about, that was basically your question as far as what long bones make up the ankle joint. Tibia, fibula, okay? Long bones. And as you can see right here. All right, and remember, this is facing front. This is anatomic position. You might be thinking, okay, is this the back? Because that is the ankle joint. Nope, that is, you are facing it anteriorly. It is right at the front. Anatomic position. Never forget it. All right. So knowing the bones that make up the ankle joint, identify the activity that constantly places stress on the ankle. I have one primary activity, and that activity is running. Okay. If you are watching this video and you have the Remind app, make sure that you let me know that you heard running is the activity that constantly places stress on the ankle. But there's additional activities like jumping, kicking. But running is just kind of the primary of the activities, often because we're not wearing proper fitting shoes. Now, on to proper fitting shoes. Your arches have meaning to it. Okay, you have 3 of them. Okay, and they serve as shock absorbers. That is a question, the answer to your question. Okay, they are very important to be able to kind of maintain pressure, especially maybe for long periods of standing, especially for beating of the ground as you run, even walk. So your arches do play a role, and proper footwear is very important to protect these arches, to keep them from getting injured or inflamed. Yeah. All right. So, what is the other name for peroneals? Fibularis. Okay. Interchangeably in anatomy or kinesiology, you'll see these mentioned interchangeably. What you'll find is that peroneals is more so a medical term, and fibularis, you might be able. Sometimes they can go back and forth with fibularis, but you'll sometimes see peroneals mentioned as far as medical terminology is concerned. But fibularis and peroneals generally mean the same thing. Okay. And you have your gastrocnemius and your soleus, which are both posterior to the Achilles tendon. Okay. Okay, going forward into the ligaments, as you can see, and I'm not going to encourage you to memorize all of these ligaments because there are a lot of them. Okay, but these are just highlighting some of the few that are highly important as far as protection of the ankle and stability of the ankle. Okay, I think I may have missed the question. Let's make sure I didn't miss one. But I'll go back just in case I do. We'll talk about what causes Achilles tendonitis. But we'll move forward and preventing foot, ankle, and lower leg injuries. This is critical. Okay, this is just a side note. If you were to ever start a side hustle within the profession of physical education, fitness, or physical therapy, this is critical. Okay, proper footwear. Most of us are not wearing proper footwear. I can attest to that. A little side note, and we'll talk about different toe issues. I do have a toe issue that I'll mention later, but this caused me to wear appropriate footwear. Because of that toe issue, I had to widen my toe box because during running or certain activities, it was just excruciating. But we'll talk about that toe issue later. Okay, and of course, making sure you're wearing protective equipment. These kind of all of these go together, but ideally, if you are running track, if you're a track and field athlete, if you are a sprinter, it's probably not a good idea to wear a pair of Jordans to practice. So that's the reason why good footwear is basically like protective equipment. Okay, getting supportive footwear is critical in protecting the bones in your foot, in your entire foot, and it just kind of goes up the kinetic chain. If you don't protect the bones and the muscles in your foot, it'll travel upward through your leg, into your knee, into your hip, and it just goes downhill from there. So, and that probably is more of a kinesiology lesson. All right, so we have a Jones fracture, which is basically a break on the fifth metatarsal, and it's very susceptible because right there, it's right on the outside of your foot. Okay, does require casting. It does require you keeping pressure and weight off of that foot, and definitely for immediate treatment, you want to consider the Price's method. Okay, we always talk about epiphyseal fractures because, again, in your younger athletes, they're always growing. So you want to make sure that there's nothing that's going to keep their bones from growing. So again, you want to refer them to the MD. You want to treat appropriately just so you're not inhibiting growth. Stress fractures are they occur when something is repetitively happening. So most cases is always happening in running. That's the reason why running stores, hint, side hustle, running stores are so popular because there's so much equipment that goes into protecting against repetitive stress and stress fractures and shin splints. And then of course, in those running stores, they do have different tests that they conduct to ensure that you're being fit for the right foot, fit for the right sole, or insole. Just to make sure that to prevent stress fractures. But in the meantime, in order to determine if you had a stress fracture, oftentimes you would do a bone scan. And this is important. Some of us don't want to rest. This is critical. Okay. Resting is extremely important. All right. Achilles tendonitis. What causes it? Jumping, running, landing. Okay. We like to see a basketball player hit the 3 points, but we got to make sure that they are protecting their lower limbs, okay? Because it often happens, especially with a lot of professional basketball players, they have issues with their Achilles tendonitis. What this means, crepitus, crunching. Okay, they might feel it. They might think they hear it, but most notably, they're going to feel it. All right. So, of course, they talk about extreme cases where the tendon ruptures and surgery is required. And that is a very lengthy, I don't even think this PowerPoint describes it enough. It is a very, very lengthy recovery process. Okay. More ligamentous injuries. You have your great toe or your big toe sprain, which is basically kicking, pushing, walking. And again, you want to pad the toe and then adopt the Price's method. You can sprain your arch. It can be painful as you are getting ready to run or maybe you want to take a walk. Same thing. Effective insoles or arch pads or taping, as well as the Price's method. Okay, plantar fasciitis. Let me see. That is a question. Plantar fasciitis, if I could say it, could lead to a heel spur. Okay. Basically, it is just, it's excruciating. I can't even explain it. It's so excruciating because I experienced that. So it can be excruciating to just move the toes and move the foot around. But if it is bad, they will need to be referred to an MD. There's all kinds of treatment modalities. Of course, Price's could work. If you're going to do Price's, the most common method to treating plantar fasciitis is taking a frozen bottle of water and just rolling it underneath your foot. It is the best thing ever. I know. I experienced it, and it is absolutely excruciating. Okay, of course, you have ankle sprains that are graded just in the terms of healing and the severity of the injury. Of course, you want to apply Price's and taping or bracing for returning. And for the ankle, as far as injuries are concerned, depending on the grade, it can take a little while for ankle to return to its normal state. Okay. Like most bones, you can dislocate it. Okay. Get them in a splint and contact or reach out to 911. That's important because you could injure nerves and vessels. Like all dislocations, you can have nerve damage. Contusions, of course, is a bruise. You want to make sure that you're wearing protective gear for your shins. Oh my goodness. If you ever had a bruise on your shin, that's excruciating too. Okay. But you always want to wear padding to protect those areas, especially right in the leg, right in the ankle. Ankle more so, foot support. But shin, yeah, definitely need the padding in the front of the leg. All right. We have hammer toes. Okay. Hammer toes can be seen on the second toe. Okay. It might look as if it's kind of in a fixed position, just slightly, or worst cases, it could be, in a complete angle. And it can be hard to wear closed-toed shoes. I ran into clients who were not able to wear shoes because of hammer toes, because of the fixed position of their second toe, and calluses can form around that toe. And the issue that I addressed earlier, okay, hallux valgus, which is a bunion. Okay. You may have heard people say bunions are hereditary, in which they are, but bunions also can be caused by wearing poor shoes. Okay. I can attest to that. And it's probably the reason why I have one now. When I was in college, oh man, when I was in college, I would make the attempt to wear 4-inch heels everywhere I go. Sometimes, not always, but if there was somebody fine on campus, yeah, I was in some heels. But this is to my demise. I kind of messed my toe up. So as a result, I love sneakers. So certain brands, I have to widen the toe box. And so this is another Remind app participant activity. Let me know that I told you Nikes are narrow. And so if you want to get some room in those Nike sneakers, get a half size up to widen the toe box. And that's exactly what I do. When I wear my Nikes, I am a half size up depending on the shoe, especially Vapor Max. Whew. Vapor Max, I almost have to go. I probably need a whole size, but half size will do for right now. And these are just examples of bunions and ingrown toenails. I'm not sure if you guys have had me in the past before, within my first year, most people know that I am not a foot person. So this is excruciating to me. But it's important that we acknowledge these conditions so we can get acclimated and properly address the needs of the person who may have ingrown toenails, bunions, and hammer toes. Okay, proper shoes are important, or sometimes they may not be able to fully participate in the activity until we find a solution for proper footwear so they can participate. So, yeah, what is the difference between hammer toes and hallux vagus? One simple one, just toe. Okay, one is the big toe, one is the second toe. Okay, anterior compartment syndrome. Now, anterior compartment syndrome versus shin splints. Okay, anterior compartment syndrome, excuse me, is a little bit more chronic. Okay, with anterior compartment syndrome, this could be excessive overuse. While shin splints can be, when it happens, it could start out that way and then the pain will go away. But of course, as activity suspends, it'll come right back. Anterior compartment, that is there. It is painful and it's been chronic, and it's, as far as overuse is concerned, it's been there for quite some time. So those are the major differences. Just know that shin splints, they come, they go away. The best solution for shin splints is always proper footwear. I feel like we did well with this chapter. So if you have any questions about chapters 17, 18, and 19, please message me through the Remind app. Please note there is a quiz on these 3 chapters. Okay. So if you have any questions on how to get through the chapters, please let me know and I will help you out. Talk soon.